Hello everyone, welcome back to my channel. I hope you all are doing fine. I have a guest with me today, Dr. Rajashree Choudhury. She is from Assam. She is my batchmate. She has recently completed her DNB Anesthesia from Kokilaben Dhirubhai Ambani Hospital. She has successfully passed both the theory and practical exams with flying colors at the very first attempt. So I am very happy to have her on my channel, and the reason why I have her here is to share her experience of the entire DNB program and how she approached the theory and the practical exams, so that the students can take the insights from here and apply in their preparation and get the best out of it. So Rajashree, welcome to my channel and thank you for taking out some time.
Okay. Hi, Chan. Thank you so much. So good evening, good morning, everyone. So this is Dr. Rajashree here on this side. So as Nishant has mentioned, has introduced me, I recently completed my DNB Anesthesia, both theory and practical, from Kokilaben Dhirubhai Ambani Hospital here in Mumbai, Maharashtra. And currently, I'm doing senior residency in one of the government teaching institutes here in Mumbai only. Okay, so yeah, hi everyone.
Okay, great. So I just want to ask you an interesting question. Like when we were filling the forms for the Neet PG counseling, I still remember you chose DNB Anesthesia over MD. So why was that, and how was your experience of choosing that?
While researching, while choosing for the institutes during counseling, so we both of us had a lot of discussion regarding that, regarding pros and cons of both DNB and MD. So personally, I always felt choosing DNB for I am saying this for anesthesia because I have always worked in anesthesia. So anesthesia, I would say choosing DNB and doing a DNB institute in a metropolitan city, in a tier 1 or 2 city, rather than going for MD in a peripheral college is always a better option. Because you will have a lot of cases exposure, because a variety of cases come, variety of people come. So you will get to exposed to a lot of cases. Hands-on will be 100%. Like we will get hands-on to all the procedures that are there in the world of anesthesiology. And plus also the conferences, the seminars, the CMEs that keep happening all the time here in its subject. That matters a lot too in the long run, I feel. That's why I personally, plus DNB, I feel it has a better opportunity for anesthesia point of view. It has a better opportunity abroad than MD, because few regions tend to accept DNB more than MD. Plus, during your preparation for your DNB exam, you study a lot. You literally, even if you don't want to, you have to study a lot. And gives you an extra edge for all your entrance examinations, your abroad, like FRCA or EDEC or anything, like if you want to settle abroad. For those exams also, it gives you an extra edge always, and it is helpful. If given the chance again, I'd always choose DNB in a metropolitan city than MD.
Okay, that is clear. So so like let us now come to the main motive of this video, which is to share your experience of when you start your preparation and how you went about the theory and exam, because like most of the students have this fear of not taking DNB over MD because they think the exams are very tough and they'll not pass at very first attempt, and that is definitely true because exams are tough, but if we prepare strategically, I think we can definitely ace the exams. And since you have done it, I have done it, so like we can share our experiences with the coming aspirants. So like I just want to ask you, when did you start your preparation and how you went about the theory preparation, like which resources you use and not?
So as like I'm from Assam, so I came from Assam all the way to here, Mumbai, Maharashtra, and I was a very bit confused at first. I was very confused. But the one single thing that I had on my mind, like while coming to pursue this course, is that like if I am choosing DNB, I need to pass it at one go. I have to pass it. I cannot waste any more of my time. So I had that in my mind, and accordingly, I started my preparation. So first few months were a bit confusing because you're getting adapted to the new place, both personally and professionally. So the people are new, your friends or colleagues are new, so it gets like I gave myself that time to get
Definitely.
adapted, but eventually it got all settled. Kokilaben is an amazing teaching institute, plus
Yeah.
very student friendly. All the faculty are really nice. They help you a lot, not just from academics point of view, but also
Got it.
from conferences and seminar. Everyone they inspire you a lot. So they helped me too. Like they literally as like gold mill yeah as a bolte na. So they literally help
Yeah.
a lot.
Okay.
Yeah. So I'm very grateful to all of my faculty. So, and preparation wise, I would say after this initial phase of getting adapted, around like on a fourth or fifth month of my residency, I started my preparation for exam. Baki OT, in OTs and all, you get to learn from the first day itself. Like
Yeah.
from basic, like from the basic anesthesia machine to quickly preparing drugs to knowing about the case, pre-anesthesia checkup, the PSA, which we say. So, but reading wise, I started it from my fourth or fifth month of my residency regularly, and I
Okay.
used to read always minimum one topic at a one day per day.
Okay.
One topic I have to read. It I
Okay.
had it on my mind कि एक
Okay.
topic खत्म करना ही है एक दिन
Okay.
में, and I used to read it, and then I have a habit of making my own notes. So
Okay.
whatever I felt is worth making notes for, like which would be useful for me or helpful for me in exams, in my future
Okay.
exams, I used to
Yeah.
prepare notes on that one. So on first year, I mainly focused on anatomy, physiology, pharmacology, or physics in
Okay.
anesthesia with a very
Hmm.
basics.
Okay.
And then on second year, I started on the case management. So there are many cases, there are a variety of cases that you get in anesthesia, and you have to pre-operatively, inoperatively, and post-operatively, you have to
Definitely.
manage them independently, and a lot
Hmm.
of medicine comes into play. In
Hmm.
the peri-operative medicine. For
Yeah.
that, you need proper knowledge from your basics, which you get completed in the first year. And then second year, it comes to the cases. So I read mainly about cases in the second year. And third year, like it's like final year, so you have
Hmm.
to start preparing seriously. And the thesis, my topic, thesis and
Yeah.
all, it came in the third year. So basically, serious preparation I started around 6 months into the main exam.
Okay.
So around so we imagined it our exams to be on
Uh,
September, April. We guessed it September,
yes.
October. So I started my serious preparation 6 months prior. That is around March, April. I completed my thesis first. I submitted it, and then I completed the study. I started reading my own notes basically.
Okay.
And
Okay.
book wise, if you say, basic is always Miller. Miller is the gold standard. So you
Okay.
have to read that Miller. Morgan book, Morgan.
Okay.
Then Stolting is very nice. Stolting is a
Okay.
very good book for your
Okay.
physiology and pharmacology.
Okay.
Plus, I used to rely a lot on the YouTube videos. There are many
Okay.
channels by ISA, National Headquarters, ISA Kerala, ICA Webinar, Anesthesia
Okay.
Simplified. There are many YouTube. Like what
Okay.
if you search for one topic in YouTube, you will
Yeah.
get multiple videos on that. And I relied heavily on YouTube videos,
Okay.
right
Okay.
from my theory preparation for until from my practical preparation.
Okay. Okay.
Plus Telegram channels. Telegram channels are very useful. There are mainly two important channels: the DNB
Okay.
theory, DNB anesthesia theory, and
Okay.
DNB anesthesia practicals. So a
Okay.
lot of PDF notes, YouTube video links, any other video links, any
Okay.
course links, many things keep coming into that group, and I used to keep them in check regularly, and I
Okay.
used to prepare accordingly for them. Yeah.
Okay.
And I completed my first read like around 2 months into the
Okay.
exam, and in
Great.
last 2 months,
Yeah.
the end of the 2 months, I completed another two revisions, like
Okay.
fast revisions, all
Fast.
the
Okay.
main topics, and then
Hmm.
whatever was confusing or like very difficult for me, I completed those I want to. But yeah, so that is in a gist, like how I prepared for my DNB examination for
Okay.
theory.
Okay. So besides these standard textbooks and the YouTube channels and the Telegram channels, so was there any other guidebook or any other platform you used, or like where the answers or question answer format are given, or anything which is helpful in framing the answers?
Yeah, so I would say like because I have a habit of making my own notes, right?
Okay. Okay.
So I use mainly used to prepare my own notes from the standard textbooks. And there's this other book called Kaushik Jyotirmay,
Okay.
like for DNB Anesthesia, which is like it's kind of like a notebook, like for
Okay.
fast revision, but it
Okay.
has covered the book has covered all the topics like nicely. So if you want, you can read that. There's like topic wise discussion on that.
Okay.
So you can read this Kaushik Jyotirmay book. Baki, I would say PDFs, articles, and journals. So in anesthesia, I feel they ask you a lot of new recent advances, a lot. So in each and every topic that is important. So I would say keep searching for those. Like register yourself in the ISA, the IJ, Indian Journal of Anesthesia. Many topics, important topics, I would say, are published on that journal, IJA.
Okay.
So get yourself registered there. It's very important. Apart from that, I would say like the ones I mentioned, that YouTube videos, Telegram channels. I think yeah, that's all. I didn't
That's
use
all.
any other channel platform
Yeah.
for my
Okay.
preparation. So
Okay.
yeah, it was
Yeah.
all my like mainly basically it was like my own self study.
Okay.
Yeah.
So we'll try to.
Articles are
Yeah.
very important.
Okay.
Whenever
Yeah.
you read any topic, whenever you search for any topic in Google, a lot of articles will come. So and there's this website WFSA, World Federation of Society of Anesthesiologists, which
Okay.
is a very good. It provides you tutorial
Okay.
kind of articles for
Okay.
each and like many topics, not all topics, almost all topics. So I relied on that too, and yeah, that's all. Yeah. Mainly, I focused mainly on my own notes. Making own notes is very important. That gives you an extra gist, like you are
Yeah.
preparing your
Yeah.
topic,
Yeah.
and that
Yeah.
that gives you an extra time
Good.
management kind of thing for your main
Definitely.
DNB examination.
Yeah. And also writing the answers give you a good memory also, like to
Exactly.
recall
So
memory
yeah,
also.
so both the tactile, visual, and while
Yeah.
listening to the videos, audio. So audio, tactile, and visual memory is
Definitely.
important.
Definitely. So we'll try to provide the links of the channels whichever you mentioned in my description. Okay, Rajashree. Now regarding the previous year questions, the question which keeps on repeating, the previous year question topics. So what is your take on that? Like, did you check the NBMS website for the papers, or were there any app you were following, or how did you extract out the topics?
So previous year questions, I would say, are the most important thing that
Yeah.
one should look for while preparing for DNB anesthesia theory. I'll say the
Okay.
most important thing. In fact, my whole preparation, like I would say 80% was like it revolved around my previous year questions. So I solved 15 years of the past, but I think 10 years is enough.
Okay.
Even 5 years is enough, I would say.
Yeah.
Like 5 years, it's like 10 papers, right? So, but I myself personally, I solved 15 years of patient papers, like, and that is very important. So, I got that from one of my seniors actually. So,
Okay.
like, it keeps coming in these groups and all. Previous year question paper based on topic, each
Okay.
topic. So I got and hand on that. So I started my preparation according to that topic. So there are very few topics I would say which I personally studied apart from those which I thought maybe would come. But personally I would say previous year questions are like the most important, like very important I would say, and it
Okay.
questions do get repeated, and like when you solve the previous year questions, you get an idea which topics are like very important and which are not.
So Rajashree, like as you mentioned, the previous year questions are very important and the topics are very important. So I just wanted to know any special chapters or important topics you would like to mention, or the PDF if you have, you share with me. I'll attach the link. But like any repeated, very high yield topics that these must you must study this. So anything you would like to mention?
Okay, so DNB anesthesia theory question like is one special point. Like while studying, you feel each and every topic is important. Like you can't leave anything. Like
Okay.
DNB anesthesia theory has that thing. But yeah, अगर बोला जाए, पूछा जाए, तो I would say cardiac and respiratory physiology. Like you
Okay.
cannot miss on that at all. Then I would say blocks from all kinds of blocks, upper limb blocks to abdominal blocks to lower limb blocks, I would say. Then pharmacology, the whole pharmacology, starting right from neuromuscular junction receptor and its applied aspects to opioids, IV anesthetic agents, local anesthetics, everything. Then it's important. It's the newer drugs like remifentanil or the newer reversal agents, like newer inhalational agents, everything
Okay.
which is there is important. For that,
Okay.
I really recommend Stolting. Stolting's
Okay.
Physiology and Pharmacology is a wonderful book. If you guys want to
Okay.
study, you should study. Apart from
Okay.
Miller, it's a wonderful book for that. The cases, IHD, which can
Yeah.
be heart disease and its anesthesia aspects from a respiratory point of view, right from one lung ventilation to COPD to pneumonectomy to everything. The long cases which are important for practical, those are important for theory too, I would say.
Okay.
Then from physics point of view, there are a few laws which might come. So that Boyle's law, Dalton's law, are very basics, which is important, I would say. And I would say thyroid, transplant surgeries,
Yeah.
pediatric anesthesia. Pediatric anesthesia, right from congenital diaphragmatic hernia to tracheoesophageal fistula, you cannot miss on these topics at all.
Got it. Got it.
Then I would say machines and monitors. The
Yeah.
whole anesthesia workstation machine is very important. Monitors, right? Starting from SpO2, the principle behind it, to BP, from non-invasive BP monitoring to invasive BP monitoring to central venous pressure monitoring to ISOB, everything. Monitors like that is important. There are a few miscellaneous topics which I can't specify now because
Yeah.
each and every topic has their own weight on each and every different anesthesia theory question paper.
Okay.
But Kaushik Jyotinath, I would say, has
Yeah.
a chapter, is a different like alag se chapter on miscellaneous topic. I would suggest students read that. Like it's
Okay.
a good read.
Good book to buy. Okay. Got it.
Yeah. And then I would say from you, like that's what I say. It's like if I get to cover it, like I'll cover the whole of anesthesia. But these are
Yeah.
few of the very topics which you cannot miss. And then right from ACLS, BLS guidelines for CPCR.
Yeah.
Then regional blocks, I would say. Neuroanesthesia point of view, the basics, I would say. Then posterior fossa surgery, positioning in surgery. Then comes laparoscopy. There are many. So it's overall, I would say. So I would like right now, like not many topics are coming onto my mind.
Yeah. Okay.
But like blood
Like,
and blood transfusion, blood and blood
yeah.
products, like yeah. So I would really suggest go through the previous year questions once. And
Okay.
yeah, each and every topic has their own weightage, like each and every different year.
Okay, got it. So, is there any way of writing a theory exam, like in the exam, because you don't have time to think, right? You have 180 minutes, you have 10 questions. Sometimes there is 10 marks question, or sometimes there is 2 questions of 5 marks. And because in exam we are so much in a panic mode also, and we don't have time to think. So definitely, while you were preparing, since you said you were preparing your notes also, so was there any way of writing an answer? Like for medicine, we have like introduction, etiology, classification, clinical features, treatment, and all. Like for anesthesia, any topic, was there any way of writing the theory answer?
Yeah, so I would always suggest to write answers in points. Like
Okay.
it's very important and it's very convenient. Like point-wise answer writing plus diagrams and flowcharts wherever you want to make. Wherever you feel like making diagrams and flowcharts,
Okay.
please do make diagrams and please do write your answers in flowcharts and points. And just the basic questions like from anatomy, physiology, and pharmacology, if it comes, just write it point wise. Like if suppose, like for an example, if a drug comes, so you just write it history if you want, classification, chemical structure, mechanism of action, pharmacokinetics, pharmacodynamics, uses, adverse effects, contraindications. So point wise, I would always suggest
Definitely.
write it point wise. And for case management patients, paper for us, paper 2 and paper 3 are mainly based on the case management, the
Okay.
anesthesia case
Okay.
management part. For that, I'd always suggest whatever case is being given to you, always write the goals of anesthesia management first. That's how the
Okay.
examiner will know that, okay, this student knows whatever he is writing, he or she is writing, and whatever he or she is being taught or whatever he has seen. So always write the goals of, like, for example, I'm just saying this long patient on mitral stenosis for a patient. So always you have to write the goals of perioperative anesthesia management for mitral stenosis. What you like the maintain sinus rhythm for preload, afterload, systemic vascular resistance regarding everything. Then come to pre-op optimization, intra-op, post-op, and then adjuncts if you want.
Okay.
Like that. Baki, I would always suggest, as told already, point-wise, diagrams wherever possible, flowcharts wherever possible, tables. Yeah, this is
Okay.
another thing. If there are many questions which come with differences, prepare tables, diagrams, always. Yeah.
Okay. I think this is very important how you present your paper to the examiner, because examiners will not like reading a paragraph.
Yeah, there's this
Yeah.
another point that I would like to mention is so there are quite a few times it happens that you don't know anything specific about that answer, about that question. It happens because DNB sometimes like uncommon questions do come in DNB. So I would say attempt. Don't ever leave any question. Like I find that is the funda to getting good marks. Never leave. Whatever topic is being given to you, if you don't know anything, just write something, because on the back of your mind, if you have prepared thoroughly for your DNB theory, you will
Yeah.
have something on the back of your mind regarding
Definitely.
that topic. If not that exact topic, something related to that you will always have. And if you start, that's why I would say writing, preparing your own notes is very important.
Very
It puts
important.
an
Yeah.
extra edge in formulating your brain into writing and making that theory answer good, like better, I would say.
Okay.
So to attempt, please always attempt all the 10 questions given to you. Yeah.
I think that is very important, and I think students will now learn how you should actually formulate the answer, because it becomes very difficult otherwise to write in the and replicate in the exams. Regarding the paper-wise distribution, like paper 1, 2, 3, 4, is there any specific pattern which is followed, or is it like random this time, or anything is not followed?
Like there is no specific pattern as such as mentioned like in the official website of NBMS, like DNB
Okay.
Anesthesia. But overall, if you say like paper 2 and 3, this is mainly anesthesia case management. You will be given
Okay.
cases. There will also be other patients, but 70% of the patients would be case management. And paper 1 would be mainly basics, the physiology,
Yeah.
pharmacology, the anatomy, and statistics, biostats. Biostats usually comes in the first paper.
This time, I think the biostats were almost 30 marks, something like that. So,
Yeah, 30 marks.
since you're mentioning biostats, would you like to say from where to study the biostats, or anything you have?
For biostats, I had no other option than to study previous year patients. So
Okay.
I took out the previous year patients of biostatistics, and then the notes that were available specific to that on those questions. And yeah, that's all. Like literally, to be honest, I only read previous year patients on it, but still our time this 2024 October DNB anesthesia theory to like 20% were like totally uncommon from biases. Like it was very difficult for, but that's what I say. Like
Yeah.
you have prepared thoroughly something and topic, then you will have it on the back of your mind to know. So ultimately you get that thing that okay, I can write this. So even though it was uncommon for us, but I wrote it. Yeah. So I
Okay.
think that gives you enough. For biostats, it's previous year questions for me and the notes
Oh.
that you will get.
Okay.
Like you can follow any biostats books, your UG biostats books, or in Telegram channels also, or in YouTube video, you will get it. Yeah. And paper 4, I would say,
Yeah.
would be like newer, the recent advances in
Yeah.
anesthesia, plus the critical care part usually
Okay.
comes, but it's not, I'm telling it repeatedly, it's not mandatory. Anything can come in any paper. But overall, in it, just you can just get an idea that this is the part, paper 1, 2, 3, and 4.
Okay. I get it. Yeah.
Another point that I would like to mention, not to miss, is artificial intelligence in anesthesia and all the
Yeah.
topics related. please do study it. Recent advances, they have been asking these a lot, right from closed loop anesthesia delivery system to artificial intelligence to recent newer artificial intelligence based monitoring, everything.
Okay. You have very nicely briefed about the theory exam. And the students who are going to give the theory exam now, who are already giving, I think they will be waiting for a practical now, the tips. So, like for the practical exam, as much as I know, I think it is 100 marks OSCE, 250 marks long cases, 4 word rounds, and 4 table viva. 10 marks each word rounds, and 15 marks each your table viva. So that is around 300 marks. So
Yeah.
since OSCE holds almost 1/3 of the marks, so I would like to start with the OSCE only.
So OSCE preparation was one of the toughest preparation. Like luckily, I got very good study partners. Both of my co-PGs were like really good. So it was like a really difficult thing to prepare, but ultimately it was done. So basically for OSCEs, I would say I followed the YouTube videos, to be honest. So there is this MB OSCE discussion in YouTube that's available for me. There is this another channel called Con 2020 playlist, which has OSCE discussions. There is playlist by Sunny's PJ sir regarding the OSCE discussion.
Okay.
Plus ISA, they also hold OSCE discussions classes like to adapt the students how this is. And mainly OSCE is very unpredictable, and it's and like in 4 minutes you will have to complete one. It's like the time goes like this, like in another. So it's combined, like all these 3 years of preparation that you have made, you have studied. So whatever you have studied, all those things keep running on your mind during those 90 minutes of your OSCE time. So I think for preparation, I would say I personally, all 3 of us had mainly prepared it from those YouTube videos only. And this master classes, that are organized by a few of the institutes sometimes. I would suggest all the students, like whoever is there in their own preferred city or area, to attend those master classes. They also sometimes they do give an idea about the OSCE session. It's for MD and DNB both, but for DNB students, they would give an. So mainly YouTube videos. Yeah, it's very well given, and it's all true. Like it will keep running on your mind all those 3 years of now your preparation. OSCE for OSCE, yeah. But yeah, you need to be really well prepared for OSCEs. Yeah, that's very scoring, I would say. If you answer OSCEs correctly, you get very high for your practical marks.
Definitely. And chances of passing the practical becomes very high.
Yeah. And in Telegram channels, like I said, this DNB Anesthesia Theory and DNB Anesthesia Practicals, a lot of links keep coming. Even PDFs keep coming in those Telegram channels regarding OSCEs. So it's just right before the practical exams, they keep coming, like daily it will come. So you can look that. And plus recalls. Because OSCEs are not available online, right? The real live OSCEs. So students do recall, and then they prepare PDFs and notes. So you can study that.
Okay. So the master class you said, like where to avail that, how to get that?
Since I did my DNB here, so I only know about my city in Mumbai. There is this one organized by Tata, Tata Memorial Hospital.
Okay.
So
It's
I
online?
attended that. No, live masterclass, like 3-day masterclass, exam-oriented program, like totally theory and practical, everything will be covered in that. So I attended the one that was being done by Tata Memorial Hospital, and in Mumbai, I'm saying there's this another one that's organized by KEM Hospital here in Parel, Mumbai. And apart from that, the other ones that I know are those organized by RACE, Chennai, Ramachandra Institute, Chennai. There is this one that's been organized by MAMC, I guess, in Delhi. MAMC already had this one of these colleges that do organize masterclass just right before the theory or practical, both for MD and DNB. It's combined. But I always feel it's better if you attend one of these. It gives you like extra edge.
Okay. So basically, OSCE is like you have to be very sharp because 4 minutes are there only for each question, 20 questions, and also the to the point you have to write. So definitely we have to. Basically, it's a theory only. You see, it's theory only, but we have to be very strong and prepare smartly. Okay, so very nice advice from you. Now, regarding the long cases, so just tell us like what are the important cases which you should not miss, because any case can be given, of course, depending on the hospital availability. But yes, like important cases A, B, C, what you should not miss. Then we'll proceed to the table viva and what round. So first, the long cases.
So for long cases and short cases, I personally had studied like all three of us, me and my co-PGs and I, we had studied this book called Tata Arc Anesthesia Review Course. So we
Okay.
studied this along with Miller's. Miller is the
Okay.
gold standard. You have to study that. And YouTube videos. YouTube has a lot of videos, especially from ISA, the national headquarters, ISA Kerala, like the ones I said, ISA webinar. They keep organizing long cases and short cases discussion like most of the time, all the time. And if you search for a particular topic, you will get one or two or three, like how many videos, however much you want, you will get. So those are very important. Baki, like if you say which topics not to miss, pregnancy. Pregnancy long cases can come like from starting from PIH to gestational diabetic mellitus to mitral stenosis, like everything is important. Pregnancy you shouldn't be missing, and like pregnancy obstetric anesthesia, I feel is a very scoring part of anesthesia because there are very few specific questions related to it, and out of those, there only the patients will keep evolving. So if you complete it at one go, then I think it will be enough for you. And for another thing is the hepatic cases, mainly the cirrhosis of liver, like non-alcoholic, alcoholic, cirrhotic liver disease, I would say is important, not to be missed at all. Then there comes the hepatic physiology and the anatomy. Because like my long case was on non-alcoholic fatty liver disease, and all they about was bilirubin synthesis, bilirubin metabolism, hepatic anatomy, central lobe, but it's like so anatomy and physiology along with that. And then respiratory cases, COPD, pneumonectomy, then lobectomy, then all the cases related to those, I would say shouldn't be missed at all. Then the other one that's important is scoliosis, very important. You get a lot of patients on that. You can get a long case on that. Thyroid, not to be missed at all. Very high yielding. Like thyroid, it can come even as a long case or even as a short case. Like what rounds, thyroid might come. So, and from pediatric point of view, if your center has a good pediatric setup, you might get cases on tracheoesophageal fistula or congenital diaphragmatic hernia. Cardiac cases, if you are in a very high cardiac setup place where you've got your practical center, you might get CABG, but the details won't be like, I don't think the Viva would go that deep. And Baki IHT is important. IHT is a very important long case, I would say. From cardiac point of view, which can be quite disease. And Baki from TURP. TURP, it's sometimes like my colleagues want it as a long case also, but it is also a short case from TURP, the anatomy of the prostate to TURP syndrome and its treatment. Everything is important. Anesthesia management, all very important. Yeah. That's what I.
So, what were the two cases you got?
My long case was very tricky. Like the first case that I got was non-alcoholic fatty liver disease. And another long case that I got was a pregnant 38-year-old, 38 weeks of gestation lady in labor with GDM, with hypothyroidism, with bronchial asthma. So my topics, my Viva went on everything. So the examiner was like, what is one topic that's missing on your Viva? I was like, pregnancy induced hypertension. There's a single topic that was missing. Might not. That's why I'm saying the obstetric anesthesia is very schooling. Another pediatric anesthesia long case, which combines with neuro anesthesia too, that I would say is the meningomyelocele cases. So the anesthesia considerations in those hydrocephalus, You might get it as a long tail. There is also like you will get PDF of long and short cases accordingly, so you can rely on that. Plus YouTube videos. YouTube videos, like if you get long and short cases in anesthesia, if you type, you will get a lot of videos on that. So yeah.
Okay, great. So like we have Kundu textbook or Archit Polo textbook like for medicine. So is there any book for anesthesia also?
Yeah. Yeah. So like I personally studied Miller.
Okay.
Then I will study Stoltings. There is this Stoltings Pharmac and Physiology that is different. And there is this book called Stoltings Coexisting Disease, which is
Okay.
like the perioperative anesthesia management,
Okay.
anesthesia cases that I studied. Then I studied the Tata anesthesia review course that I studied. That will.
Okay.
And for instruments and table fibers, I mainly relied on the masterclass that I did on Tata ARC.
Okay.
And then I Dosh, there's this book by Dosh and Baheti. Baheti is this instrument, anesthesia equipment and instrument books by Baheti ma'am.
Okay.
So
That is it.
important. I
Okay.
mainly relied on it.
Okay. Now coming to the tables. So there are 4 tables, I think, table viva. So what can we expect in the table viva? Like how it is arranged, like instruments, ECGs, or like how it is? Yeah, anesthesia, how it is?
So my center, so the one table had all the airway instruments, right? Starting
Okay.
from the nasopharyngeal, oropharyngeal airway to supraglottic airway device to resuscitation devices to intubation devices. It had all the supraglottic airway device. I would advise is one of the most important topic. You cannot miss on that at all. You have to study A to Z of the supraglottic airway devices. It's very important. So one of my tables had that. And then other table had ACLS, BLS, resuscitation wala table was there. And along with that, side mein there's anesthesia workstation. There's all these cylinders and the machine. So mainly they would not go. They will for anesthesia workstation. I'd advise the student not to go into that deep. It's just that our machine is divided into high pressure system, intermediate pressure system, and low pressure system. And accordingly, you can study on the things if you know. And the physics in anesthesia. Physics is very important. Physics is one of the main topics, like in the anesthesia workstation when it comes to play. So I would advise the students to go through that. The other table that I had was on like the basic instruments, like there's this IJB cannula, IJB triple lumen catheter. There's this spinal needle that we usually have, the Quincate, Whittaker needle, then the Tupoy needle, I would say. So there's this other instrument. So one table. Actually, like there used to be like my center, like 4 tables, but kind of mixed.
Yeah, I got it.
Yeah. So and then the other table had X-rays, chest X-rays, then ECGs. I would say. And ECGs, my viva went to like BLS, ACLS, PFTs, pulmonary function test, the graphs and the flow graphs and all. Yeah, the ABG analysis, blood gas analysis. So my has had that. And along with that, there was this, along with the instrument table that we had, this Quincate, Tupoy, and along with that, we also had the drug table. It was together. Like so, drug. There are various drugs, innumerable drugs, like all the drugs. So it totally depends on you. It's your luck what drug. I personally got potassium chloride. So what's the use? Like then my viva mainly went to like hypokalemia, from there ABG, ACTs, imbalance. And along with this chest X-ray, ABG, that table, there is this newer recent updates in anesthesia. Thoda sa, kind of 5 minutes of viva on the resident consults in anesthesia. So it's basically all mixed. So if you study like I studied this Dosh and Baheti for anesthesia equipments plus Tata ARC. In the back, they have this table viva preparation tips. So if you study that, plus YouTube videos. YouTube videos has everything.
True.
Wonderful resource, I'd say.
Okay. So like basically for the tables, we need your drugs, your ECGs, X-rays, ABGs, then your instruments and anesthesia workstation, and procedure related topics for the instrument which is
Procedure
procedure related.
related topics,
Yeah,
yeah, and ACLS,
and BLS,
it's a
yeah,
separate
emergency.
5 marks.
Okay, yeah. So ACLS, BLS, and the last is the recent updates. So if you are thorough with all this, at least you can go and attempt the Viva at least. Okay.
Even anesthesia workstation is very scoring, I would say, if you study
Okay.
properly. It's very scoring. Like if you get to answer, because there are very few specific questions related to the workstation. If you answer that, I think you're way good to go.
Okay. So for the ward rounds, Rajashree, like, can you just share the experience what this ward round is all about? Like 10 marks, 10 marks, which is given.
So
What they
ward
ask.
rounds for us is okay. Ward rounds is basically like short case. Short case. So anything they might ask anything, any procedure. For me, like I got like fiber optic intubation, one short case because there is this hemithyroidectomy, huge goiter patient for hemithyroidectomy. I got meningomyelocele as a short case. So it's like that. So it's mainly short, like what are the anesthesia management, anesthetic considerations they would ask, and the important topics related to that case they would ask. So I think that's in a gist about the practical exam, and like all the best. Very like I would advise all the students to study properly from the first year itself. And it's not difficult to crack DNB anesthesia at all. Theory and practical, but you can cover it. You can get it at one go. But you have to study sincerely and be proud of yourself that you have chosen this branch of
Definitely.
and all the best.
Okay. Thank you, Rajashree. Just like last one question I would like to ask you. Like the DNB culture is when you go for the practical exam, you go to a different city, you go to a different college or a institute where you have no connections or you don't know the HOD or nothing. So can you just tell the candidates like what is the experience you go through and how you can overcome that, like with your preparation, or like what is that stress which is associated? Just share a little bit about that.
Yeah, so it's confusing, I would say. I personally was very perplexed. I was very scared. I was worried because I'm from Mumbai, but I got my center in Delhi. But I would say if you are thorough with your basics, if you're thorough with your theory and your practical preparation, if you have that confidence in yourself, plus OSCEs, just keep it in your mind that you have got to clear OSCEs as much as possible. And if you have that confidence in yourself, like it doesn't matter at all. And like remember always, like it's always better for you in the long run. Like because in the future, whatever interviews you'll be giving, it's gonna be like this, completely new place, unknown. And I would say it's better, I would say. It's maybe personally, you don't have to know anyone, you don't have to pay it to anyone. It's like totally a new place. So I think if your preparation is thorough, you have nothing to worry about at all. That's my personal experience. Like I know it's very confusing, like it's very like very scary for students. I personally was, I myself was at that stage. But once I got through it, got through the day, and you won't even know how your day had passed. Like from 8 to 5 in the 8 a.m. in the morning to 5 p.m. in the evening, you won't even know. But if you are thorough with your preparation, I repeatedly keep saying this, and believe in God, take blessings from your family, from your friends, and I think you will make it at all. It's not difficult. Always be proud of yourself and know that it is always better for you in the long run. In the long run, it's always better if you get your center at a very unknown place. It's okay. It doesn't matter. It's just you. You are the same. The people around you are different. You are the same. Your preparation is the same. What's there to worry about?
And there's one more thing, like no examiner is there to fail you. Like obviously if you do a very big mistake, then it's okay. Otherwise they are not there to fail you, they are there to pass you. If you are trying to, you are only the one if you who will make yourself fail if you are making a gross mistake. I think that's the entire summary.
So no examiner is ever going to make you fail. No examiner will, even if you answered in the dumbest way, they will ask you an even more basic questions. Like what is BP? People have been asked that. What is blood pressure? So if you answer that all the examiners will try to make you pass. Another important thing, work on your thesis from the first year itself and get it completed just 8 to 9 months prior to your main exam. That's very important. Once you complete your thesis, you can aram se prepare for your theory and practical both.
Okay.
And always have confidence in yourself. Always be confident.
Thank you so much, Rajashree.
Okay.
Thank you so much for joining and sharing your insights. I am very
Thank you
grateful
so
to you,
much
and I
for-
hope the students will benefit from this.
Thank you so much for including me. All the best, students. Bye. Thank you.
Okay. Okay.